Good evening, everyone. HIPAA regulations require nurses to protect their patients' privacy. However, there are times when nurses struggle with their personal beliefs. How many of you have ever withheld life-changing information from someone because you was bound by secrecy for another? Did you find it to be an easy decision? Or most importantly, are you still struggling with it? Nurses are tasked with these dilemmas every day. In order to maintain patient confidentiality, nurses should respect their patients' wishes, omit their personal biases, and adhere to HIPAA guidelines. Let's take a closer look in order to have a better understanding. According to a story published by Nursing Magazine, a nurse was faced with maintaining confidentiality of her patient, who was hiding a 10-year HIV diagnosis from her family and friends. How did the nurse accomplish this? By only discussing patient care and giving her HIV-related medications when visitors were not there. So here comes the tricky part. Keeping the secret from family and friends were easy, but the nurse struggled with keeping the decision from her patient's significant other. After all, it posed a risk to his health as well. Now, getting back to the question I posed in the beginning, would you find it to be an easy decision? For the nurse, she had to put her personal feelings aside and do what was ethically right for her client. After several attempts were made to encourage her to reconsider and reveal her status to her loved ones. Some people may think the patient should have told. For whatever reason, she refused, which was her right. Knowing this, the nurse upheld her obligation and respected her patient's privacy. It is easy to get caught up in what we think is right, but we must also remember our obligation and know our limits and be very careful of crossing boundaries of what we can do within our fields. What if the nurse informed the patient's sexual partner of his exposure to HIV and he caused her harm? That would have left the nurse responsible because she operated beyond her scope of practice and did not follow standards of care. In the end, the nurse provided the best care for her client without compromising her ethical duties. In fact, an article posted on Virginia Department of Health explained facilities have protocols in place to report HIV cases to the health department, who then inform partners about their risk of infection. With that said, if asked, the nurse can be sure she made the right decision by abiding by the guidelines that was set in place. As you leave here today, take care to maintain your trusted professional relationships. And remember, being a nurse is a demanding task. It's also critical that they respect their patient's wishes and omit their biases, because it demonstrates professionalism. Additionally, it activates adherence to HIPAA guidelines, which is vital in order to demonstrate objectivity in this field.